The number one reason people bring kids to the emergency department is for fevers. There's all of these myths out there about this magical 104 number, that your brain is gonna fry and your proteins are gonna denature and you're gonna have a seizure, when in reality, not any of that's true. Febrile seizures can happen in kids under 6, and they can happen in any temperature. If your child is in one of these categories, a fever is an emergency. If they're not in one of these categories, the fever might not be an emergency, but what the child looks like could be. If they're having difficulty breathing or they're dehydrated, but the number on the thermometer is not the emergency. In medicine, we have a saying that goes, treat the patient, not the number. If you have a kid that is 104 degrees and they're running around the living room, chugging a Gatorade, they're probably cool to not come to the ER. But if you have a patient that's 100.7 and they look like crap, they might need to come in. When my own kids are sick at home with a fever, if they are comfortable and hydrated, I give them a drink and an iPad and let it ride. If they are not comfortable, I'll give them some ibuprofen or some Tylenol, document it on a note card, the med and the time, and keep an eye on them closely. Don't waste your money on the forehead or the ear thermometers. Get yourself a normal digital thermometer that's not going to break the bank. You can take the temperature in the mouth, the armpit, or the booty for babies. And a fever is 100.4 degrees Fahrenheit or 38 Celsius for everyone. It doesn't matter if you typically run low or not. That's a fever for everyone. If your kiddo's having difficulty breathing, any concerns for dehydration or altered mental status like confusion, or if your gut tells you something's up, it's time to head to the ER.